Okay, welcome to this tutorial, this lesson, talking to you about the leg bones and features. So here we're going to start off with an overall view of the leg. Now we will get to the foot, so really we're talking from ankle up, so from the pelvis down to the ankle. And these bones you're likely familiar with, and I may have used them at different times. Where do you think I should put? Oh, let's start with the let's actually start with patella because most people know patella. Where's my patella? Patella is your kneecap. So I'll drag that here. It is the largest of those sesamoid bones that can sort of float. It's really kind of protecting the front of your knee. This can be dislocated if it goes off to the side and has to be kind of put back in place, stretches out some ligaments and things that are there. So let's next go with the tibia. The tibia is the largest of the lower leg bones, and so this, if you're your shin, I guess you could kind of say if you touch your shin, that is your tibia. Now, next to that, fibula. So be careful. Some people want to call it the tibula and the fibia, or the just right once you type it a few times. Now there is a kind of a really straightforward, simple way to remember that the fibula is the smaller of the bones. So just like we had in our forearm, we had the radius and the ulna. So the ulna is actually analogous to the tibia, and the radius is analogous to the fibula, as it turns out. But back to how you can remember that the smaller bone is the fibula. So when people tell a lie, they just tell a little white lie. And so you can remember the fibula is the smaller of the bones because you just tell little fibs, not big fibs. Femur, maybe I should have done that first. The femur is the largest of the bones in your body. I think somebody told me the other day that it's about a third of your body length. I'll believe that student. They seemed pretty knowledgeable about the subject. So that's probably not too far off with the femur. Now, not a bone, but just like we had in the forearm, we had that disappeared. I know why that disappeared. Let me try that again. Let me put that back and let me make this come to the top. Sorry about that. So let's move that back over here. Oops, that's next page. The interosseous membrane in between the tibia and the fibula. Exact same purpose that we had in the upper arm. Just kind of connecting those two bones together, giving them some support. The interosseous membrane of the lower leg. And again, we'll get to the lower leg bones, or excuse me, the foot bones coming up in a couple of lessons. So now, let's talk about the different. I'm going to grab a pen here. Let me grab some blue. I'm going to put some numbers over here of things that are features of the bone. Actually, let me come back. I'm going to make these a little bit. I'm going to space them out a little bit here. There we go. Okay. Oops. Let me try one other thing here. There we go. So now we've got a clean palette to work with. Okay, now just like we had features of the arm bone, and this is analogous to your humerus. If we think about the arms and legs being analogous features, greater and lesser trochanter. Now we had in the upper arm, if you remember, we had the greater and lesser tubercles. And so they call these a little different. They're larger, but the greater trochanter will be the larger of the two. So we've got one that's right here, and the second one that we can only see, well, we can see it here, and we can see it barely sticking out. So you can get an idea of which one's the greater and which one's the lesser. So the greater is our number 3 here, and the lesser is number 4 on the diagram. Next, the head of the femur. So this is, if someone needs to have hip replacement, this will often be cut off. They'll do a cut about right here. They'll remove the ball of the femur. They'll drill into the femur and insert a new ball. They'll also do the socket. If you remember the acetabulum, that was the socket of the pelvis, will fit right in here, and that's also replaced when we do a hip replacement. So the head is number 1. The neck, pretty straightforward, number 2, where it kind of narrows down. Now I'm kind of moving down the bone. This is the back of the femur. And we actually have this feature. It kind of looks a little sharper here, and it would be for muscle attachment. We actually call that the linea aspera. Linea aspera. Now, moving down to the inferior region, and I guess we should have talked about, so this is anterior and this is posterior, kind of makes a little bit of a sense. In the front here in the anterior, sitting right here, if this were the knee, would be the patella. So this surface, number 7, is what we refer to as the patellar surface. Now, I don't think this is in your text because it's kind of covering, but it does make sense. This is where the patella will articulate and sit. Now, let's talk about on the outside. And actually, in fact, I've realized that I've actually forgot to put a couple of terms in here. So let me actually come in here. You can add those in here. So we're going to have lateral epicondyle and medial epicondyle. Okay, I'm going to grab my tool back here. So if you recall, epicondyles were on the very outside of the bones. And so if this is the anterior, we would have medial in here. So here's our medial, and here's lateral. So this little surface here, this little things that stick out here, are lateral and medial epicondyles. So the lateral would be number 5. And I just realized I erased all of my things up here. That's okay. And the medial epicondyle is number 6. You can kind of palpate these. Palpate, when I say palpate, you can kind of feel these on your bones. Okay, so we had the surface here. This was number 7. Linea aspera, that was our number 11. Okay, so I'm just thinking what we had done here. And here we have number 1, number 2, the lesser was number 4, and the greater was our number 5. Okay, so make sure I get all these. Okay, now the condyles. Now the condyles are these large surfaces here that the bone will articulate on to the legs down, or to the bones down below, so our tibia and our fibula. So these articulating surfaces are called condyles. And so the lateral condyle, if we're over here, which remember, here's our lateral. This is the outside, medial's on the inside. So lateral condyle will be number 10, and the inside condyle will be number 8. So it is a little tricky to keep the condyles and the epicondyles separate. The epis are more on the outside. They're upon the outside of the bone here. The condyles are these articulating surfaces. I think we might have saw a condyle maybe with the jaw. We actually call it a condyle where the mandible touches the mandibular fossa, kind of a rounded surface. I just realized it's spelled lamp. It has nothing to do with lamps at all. All right, so there are the femur landmarks of bones. Okay, so let's now move on to the lower leg, the tibia and the fibula. So if you recall, our tibia is the larger of the bones here. So here's our tibia, and then down here, there's the fibula, because we tell little fibs. Also, recall in between, that's an interosseous membrane. So we've got these things taken care of. Now, let's go ahead and let's do the fibula. Let's go ahead and do the landmarks of that. So the fibula, okay, a little smaller of the bones. The head is really what we just referred to up here. Up here is the head of that, and it actually does have a neck. So number 1 there. Next is the lateral malleolus. Now this is, you can palpate, feel this very easily. So I'm now working down my right leg all the way down to my ankle, and I feel that little bulge, kind of bump of the bone. That is called the lateral malleolus. This is the one where if we talked about if you evert your leg, your foot, and that's whenever it turned outward, this little thing could get broken off by your foot bones. I believe it's the calcaneus can come up and actually chip a piece of this off. But this is the lateral malleolus. So I'll go ahead and label that as B. And I just realized that I actually labeled that one. It was actually an A. I did these in numbers and these in letters. Okay. Now, ready for the tibia's landmarks. Pretty straightforward here on, we've already seen some epicondyles. We know those are on the outside. And again, epicondyles can be on lots of bones. These would just be the lateral epicondyle of the tibia. I'm not going to hold you responsible for calling it lateral epicondyle of the tibia. I'm going to presume in other questions I'll ask you if it's a tibia. So you don't need to add those things to the end. So let's think about so we're looking at the front of the leg. So again, this is anterior, and this is our posterior view. So if we're looking, and this is a right leg, this is a right leg, so here's medial, and here is lateral. Now we already saw down here, here was the lateral malleolus, so lateral is also out here. So you kind of have to orient yourself to which way is which. So our lateral epicondyle, the lateral epicondyle would be this little process right here. So here's number 1. Inside here, this would be our number 2. And it would be the same thing here. This would also be the medial, and out here would be the lateral. Oops. Get it right here. All right, next, let's see, we've got this done, we've got that done. Inner condylar eminence. So you remember those condyles that have actually rotated, and I can't do a very good job, I'll try to kind of, so there's our tibia or femur that would have come down. Here are those condyles. So this would have been the lateral condyle, and here's the medial condyle. Now we'll see in the knee later, there are a couple of meniscus that sit on here. So right now our student, Aaron, I'm recording this in 2019, just went in to have some meniscus cleaned up a little bit. She had some tear, but right in the middle right here, we have this little part that sticks up. This is called the intercondylar eminence. Eminence kind of sticks up. If somebody says your eminence, I think that's kind of a term used for royalty. So eminence here. So it's just little parts and it sticks up. We can just see it right here as well. So this would be number 3. And this little portion right here would also, I don't think we have this is getting really messy. I apologize. So this little portion sticking up here, up into this little fossa here that we had, and I think we saw it in the last plate. All right, anterior border. This is the very front of your tibia, and this is. Oops, that's not right. Why did I put A? Anterior border, number 4. This is where it's very sharp, actually. I think this is kind of a common place if you're shaving your legs to kind of cut your legs there, because it's pretty thin skin right there. If you hit this up against something, it really smarts, because that front of that bone is very sharp and cuts into the skin pretty easily. All right, and then tibial tuberosity. A tibial tuberosity, we actually had a thinking back here to the humeral tuberosity, where the deltoid tuberosity, and I think the labeling for this one is right up here. It's actually, there's some ligaments that are going to attach to this that kind of go up to the knee or quadriceps. So this little portion that sticks out right here, and you do have that in your text has that. So tibial tuberosity, this little bump, and you can feel this. You can definitely feel this below your knee. You can feel this little rounded portion of the tibia. So I'd encourage you to kind of feel for that to kind of get a reference of that. And then finally, our lateral malleolus. Medial malleolus towards the inside. So this number, again, this is our middle here. And so here's our medial malleolus, number 6, and number 6 right here. And again, you can feel this on the inside of your leg. You can feel that medial malleolus, which generally doesn't get broken when you do inversion of the ankle, the way you did lateral eversion, where the lateral malleolus can get damaged. So I'm going to clear this off really quickly and just kind of go through these real quick again, just to go through quick to clear that thing off. So here's that eminence. Here's that eminence. We have the lateral epicondyle, medial epicondyle, tibial tuberosity. Here's that head of the fibula. Here's the head of the fibula. Pardon me as I let a couple of cats in and out. um, let's see. We had in the front of this was our anterior border that can is real sharp. Interosseous ligament or membrane we have between here. You can use either term. Now we're not going to do the joints of these, but some of these are actually the joints that are in between there. If you remember, we had a distal, radio-ulnar, and a proximal. We have a very similar thing in the lower leg as well. Here are our malleoluses. So here's the lateral malleolus out here, and then medial malleolus. And again, these are the ones you could palpate pretty easily with your hands on your leg. Let's see, did I skip anything? I think I might have got these on this plate. So hopefully that's helpful for plate number 38. And thanks for watching.